Welcome to the Private GP podcast. I'm Alia Shakir, the Managing Director of Walk-In Clinic, and I'm here today with one of our GPs, Dr. Mohammed Maseni. Hello.
Hi.
And today we are talking about erectile dysfunction. Obviously, we see gentlemen at the clinic with this issue, some of them for having experienced it for a long time or intermittently over various years, and others who perhaps have experienced it for the first time. It seems that maybe we've been seeing more cases of erectile dysfunction since the pandemic. Do you agree?
Of course, yes. I think that is definitely the case, and there are sort of various factors involved in this. Erectile dysfunction in general is a multifactorial sort of condition, and during the pandemic, people being isolated, being out of contact with others, um, which had sort of various different effects on them, likes of increase in anxiety, sort of having a lower mood, as well as problems with not having enough exercise and a good diet. So a lot of people put on some weight, so blood pressures went up, and so on, and all of these factors were sort of the contributing elements in erectile dysfunction.
Very interesting. I read a study somewhere that said that having COVID might increase your risk of erectile dysfunction like 5 times. I mean, is this something you think that is just needs more research or?
Yeah, I think COVID has got several unknown aspects. We're still dealing with some chronic cases of what's called long COVID, which are side effects that people are experiencing following having a severe infection with COVID. And there's a lot of unknown, so definitely it's something that requires more investigation and research.
Thank you. That's really interesting. So, what would you say are the main causes of erectile dysfunction in younger men versus older men?
So younger gentlemen who tend to be sort of less at risk of conditions likes of high blood pressure and high cholesterol, they tend to have what we call non-organic causes for erectile dysfunction. And this is by and large anxiety and perhaps maybe low mood and lack of confidence, perhaps maybe due to problems that they had as a child, or various different factors. But the majority of them, from what I can see anecdotally, seems to be non-organic causes.
So we would call that what, psychological causes, more
More
likely?
more related to psychological, yeah.
Understood. And in older men, what are the physiological or organic reasons that
So in older men, conditions likes of diabetes, likes of high blood pressure and high cholesterol, problem with hormones, which may sort of deteriorate with age, and also at the same time anxiety and depression could be contributing factors.
yeah, and I guess stress as well, chronic stress and work-related stress as well.
Definitely, and so both ways, in sort of younger men, sort of they may be working at lower level jobs, which is perhaps maybe more difficult or longer hours, and in older gentlemen with responsibility in the jobs that they are, maybe more stressful, and both of these things could have an effect.
Totally understand that. Um, so really what you're saying as well is, say, especially in older gentlemen, that they really need to take this symptom very seriously because it could potentially be a symptom of a underlying condition.
Absolutely. It is very important. Often gentlemen are not very forthcoming. People that I see in the clinic always tell me that they have been having this problem for years, sometimes 2, 3 years, before they decide that they need to address that. And it's definitely an important message that we would need to seek help for this, because this is a condition that has treatment, and if we find out what is causing it, then addressing the treatment, addressing the condition would be very, very easy.
So let's say somebody comes to see you with this symptom. What testing would you usually recommend?
So the sort of the consultation that I conduct is a comprehensive history taking, looking at various aspects of both physical and mental health, social sort of circumstances of a person, and also their interaction with their environment, as well as a full physical examination and some blood tests, as you mentioned. The tests we usually run a full blood profile, and that includes tests for cholesterol, tests for diabetes. We check the prostatic specific enzyme, which is called PSA, and also we check for various hormones, which could have effects on the healthy erection.
Such as testosterone levels?
That's correct, yeah. Testosterone levels, prolactin levels, and sort of the hormones secreted from brain called FSH, LH, the stress hormone, which is DHEA sulfate, and also a protein called sex hormone binding globulin, which could affect the free androgen index, and that's basically availability of testosterone to the body tissues.
Okay, really interesting. And then you combine your consultation, your examination, the test results, and then you give that patient a call. And if there's an underlying condition, I guess we address that. If there's no apparent underlying condition, what happens next? Is there a treatment available, or what do you usually do?
So, like you said, if there's any underlying condition that we detect, which in some cases I have picked up a silent diabetes in someone who didn't absolutely no idea that they might have diabetes.
Wow.
And things like that we could treat, obviously, and if everything comes back normal and the examination is normal, usually during the consultation I would have picked up some psychological cues about the possible causes of this. Then this is what we usually sort of discuss with patients, and there are various options available. There are sort of therapy options available for them, and some people still would like to have further investigation, which is absolutely fine, and we usually in these cases refer them to an andrologist who is a consultant who deals with cases similar to this, and it will be at perhaps maybe a higher level of running various different tests, which could sort of help as well.
Of course. And I guess for some men, let's say the cause is psychological, just having the awareness of that helps enormously, doesn't
Absolutely,
it?
absolutely. It is very important, first of all, to reassure the gentleman that everything from a physical point of view is absolutely fine and they are in good health. And then in the meantime, we could give them advice about a more healthier lifestyle, things like stopping the smoking, reducing their sort of alcohol intake if they take sort of if they drink more than recommended dose of 14 units per week. Things like sort of losing weight if they're overweight, and also having a more active lifestyle if they don't exercise as much. So these are the things that we use the opportunity to promote, in the sense that sort of trying to help gentlemen to have a healthier lifestyle, which often these are the main elements which is sufficient to resolve the problem, but at the same time, sort of address any other issues that we might find.
Thank you so much, Dr. Maseni,
You're
for
very
your time
welcome.
today.
It was a pleasure. Thank you.
Thank you.